Welcome to This Explainer. We've all been there, right? You're lying in bed, you feel absolutely terrible, and your body is going through what feels like a completely counterintuitive routine. Today, we're going to look right under the hood of a fever. We're going to unpack the brilliant, highly coordinated biological machinery that's actually driving it.
It's literally the ultimate paradox of being sick. Why is it that when you have a sky-high temperature, when your body is practically radiating heat, you're desperately piling on 3 heavy blankets and shivering your teeth out? I mean, it feels like a glitch in the system, doesn't it? Like your body's wiring just somehow got crossed. But to solve this mystery, we actually need to completely rethink how we view being sick in the first place. To get to the bottom of this, we have to completely shift our perspective. Listen, a fever is not your body breaking down. It's really not a malfunction at all. It's a highly coordinated biological strategy. Your immune system is going to war, and the fever, well, that's just a calculated tactical move in that battle. And to understand exactly how this tactic works, we first need to meet the culprits that set the whole thing into motion.
Enter the pyrogen. Basically, a pyrogen is any substance that can induce a fever. Think of it like a blaring alarm bell ringing directly in your brain's control center, specifically in the thermoregulatory center of your hypothalamus. But here's the fascinating part. Not all pyrogens are created equal. Actually, there's a very distinct biological relay race that has to happen in your body just to get that alarm bell to ring.
So there's this critical 2-step difference in how the alarm actually gets triggered. First up, you have exogenous pyrogens. These are the outside invaders. Think bacterial lipopolysaccharide from gram-negative bacteria. But here's the kicker. These invaders don't trigger the fever directly. Instead, they provoke your body's own host macrophages into producing endogenous pyrogens. These are your inside alarms, which are cytokines like interleukin-1, interleukin-6, and TNF-alpha. It's an internal relay system. The invader breaches the wall, and your very own cells are the ones that sound the alarm.
The really crucial point here is how this rapid-fire chemical cascade plays out chronologically. Step 1, your circulating and tissue macrophages detect those outside invaders. Step 2, they release those endogenous cytokines, those internal alarms we just talked about, directly into your circulation. And then step 3, those cytokines travel straight to the vascular endothelium of your hypothalamus and stimulate the local synthesis of something called prostaglandin E2, or PGE₂ for short. This tiny little molecule is the ultimate switch that changes absolutely everything. Okay, so under normal conditions, the preoptic area of your hypothalamus maintains a pretty strict set point right around 37 degrees Celsius. It's basically your body's internal thermostat. But that PGE₂ we just synthesized, yeah, it's about to hijack the dial. PGE₂ acts directly on the thermosensitive neurons in your brain and literally cranks the dial up. It physically changes the set point. So the thermostat that used to say 37 degrees now says, I don't know, maybe 39 degrees. And here is the genius, albeit slightly miserable part. Your physical body is still sitting at 37 degrees, but your brain now firmly believes the target should be 39, so it effectively tricks your body into thinking it's dangerously cold. And boom, that solves our opening paradox. Because your brain genuinely thinks you're freezing, it frantically activates heat conservation mechanisms. This is exactly why you get chills and rigors. Your blood vessels constrict, that's peripheral vasoconstriction, pulling warm blood away from your skin to save heat, which gives you those icy cold hands and feet. You get piloerection, which is just the fancy word for goosebumps, and most dramatically of all, you start shivering. Shivering isn't actually a sign of being cold. It's rapid, involuntary muscle contraction specifically designed to physically generate heat to reach that new, higher set point dictated by the PGE₂. Eventually, all that frantic shivering and heat conservation actually works. Your core body temperature rises until it finally matches the new set point on that hacked hypothalamus thermostat. We call this the fever plateau. Once you hit this target, your brain stops panicking. The shivering stops, the chills completely go away, and suddenly you just feel incredibly hot. You are now officially baking at the exact temperature your immune system ordered to help fight off the infection. But hey, thankfully, fevers don't last forever. As your immune system starts winning the battle, the pyrogenic stimulus, those outside invaders, gets cleared out. As a result, your macrophages stop pumping out cytokines, and those internal alarm levels start to plummet. Without those cytokines constantly pushing it, the PGE₂ production stops, and the hypothalamus thermostat drops right back down to normal. This turning point is a process known as defervescence. But now, your body faces a completely new problem.
The thermostat is back down to 37 degrees, but your physical core temperature is still way up there at 39. So now your brain thinks you're dangerously hot. To fix it, it triggers rapid heat loss mechanisms. Your blood vessels dilate, vasodilation, flushing all that warm blood back to the skin, which is why you look red and flushed, and crucially, you start sweating profusely. The body is just rapidly trying to cool down and dump all that excess heat it just spent the last few hours generating. Now, because we understand this intricate mechanism, we can actually use it as a brilliant diagnostic tool. You see, fevers aren't uniform, and the specific temporal pattern of these temperature shifts provides massive clinical clues about what specific organism is causing the infection. For example, a continuous fever with very little variation might point straight to typhoid. An intermittent fever that drops back to normal every single day, that's pretty typical of septicemia. A remittent fever that stays high but fluctuates wildly might suggest infective endocarditis. Even a relapsing fever, separated by days, points to a Borrelia infection. The timing pattern itself is a vital piece of the medical puzzle. Of course, when we have a fever, our absolute first instinct is usually to reach for medication, right? Antipyretics, like paracetamol or ibuprofen, actually work directly on this very pathway we've been discussing. They inhibit the cyclooxygenase pathway. By doing that, they literally stop the synthesis of PGE₂ in the hypothalamus. They forcefully lower the thermostat back to normal, making you feel so much better, but, and this is vital to realize, they do this even if the underlying pyrogen, the actual infection, is still present. They mask the fever, sure, but they don't actually fight the invader. Let's look at how this plays out in real life with a quick clinical vignette. Imagine a 26-year-old woman presenting with 30 minutes of violent, shaking chills, which is then followed by intense, radiating heat and finally, sweating. Based on what we've just learned, we know exactly what's happening under the hood. A bolus of endotoxin entered her circulation. Her thermostat spiked. Those shaking chills, that was just her body forcefully generating heat. The intense heat she felt was the plateau. And the sweating, that was the differvescence. It's the entire biological pathway we just mapped out, playing out in real time. And this directly impacts how laboratory scientists and doctors treat her. Because we understand this physiological cycle, we know that the physical symptom of shivering, the rigor, almost always coincides with peak bacteremia. That's the moment of maximum bacteria in the bloodstream. So drawing a blood culture exactly when the patient is having those freezing chills actually maximizes the chance of capturing the organism and getting a highly accurate diagnosis. Her physical symptom is directly dictating the laboratory strategy. How cool is that? So the very next time you find yourself buried under a mountain of blankets with chattering teeth, just remember what's really happening under the hood. Those chills aren't a sign of failure or a system glitch. They're physical evidence of your internal thermostat being hijacked, a brilliantly coordinated chemical cascade, and your muscles working in absolute overdrive to turn up the heat on an invading pathogen. It really makes you wonder, is your next fever just a sign of sickness, or is it actually a masterpiece of biological engineering? Definitely something to think about next time you reach for the thermometer.